Hello, viewing audience. I'm Vince Solis. I am the host of Chomp Talk. I am the president of Brazosport College. Welcome to another edition of this podcast that features all the great ideas that are as sharp as gators' teeth at Brazosport College, where the conversations always bite deep and we navigate the waters of knowledge and information and all things related to BC. Today, I'm really excited because we have got two of our amazing, outstanding, exceptional faculty members from our nursing program, and we're going to talk nursing. We're going to talk about all the things related to the things that provide nurses in our community. So we have with us Ms. Samantha Resecker, who is our program director, and Dr. Lea Anne Quave. Welcome to the show, ladies.
Thank you, sir. Thanks for having us.
Good. So let's talk nursing. You know, I always like making sure that our students in our community know who's teaching our students and who's working with them on a daily basis. And I know we got a lot of things to cover, especially about all the amazing success that you're having in the nursing program. But let's talk a little bit about you all as individuals. I want to know, you know, your background in nursing and what do you enjoy about working at BC?
Well, I stumbled upon nursing. I was registered for classes at a university for a business accounting degree, and somewhat randomly signed up for the Army Reserves right out of high school.
Thank you for your service.
Thank you. And through that, I was deployed to Kuwait, and while I was there, I got really just sick. I mean, like a little stomach bug, and was at the hospital, which was a tent in the desert. And so, just sitting there miserable and just watching the military nurses running around, taking care of soldiers, taking care of the nationals there. And I was just like, wow, that's an awesome job. I would love to do that. And so I applied to nursing school from the desert, got on a little computer in a box that they had set up for us.
Which nursing school did you apply to, Sam?
I went to the University of Missouri in Kansas City, and just fell in love with it. And then graduated and became an ER nurse and just fell in love with that and started teaching ER nurses. And then it just progressed from there. I discovered that I love helping people learn, and I love helping people learn about nursing. And so just grew from there, and then eventually went on to get my master's.
Very cool. Well, we'll get back to what you enjoy about working at BC, but Dr. Quave, what's your background? You've been in the profession a long time. What's your background?
Well, mine's not quite as glorious as and exciting as Sam's. I was a late bloomer nurse. I guess I was. I used to be a real estate agent, and I thought that was really stressful. So I wanted to get into something that was
less
stressful.
So you went into nursing.
Yes.
Okay.
And I was in my 40s when I graduated, and I actually got my first degree here at Brazosport College when I was. I'm not going to give the date. It was a long time ago, right out of high school, and it was in computer technology. And then I got married and started having babies.
Okay.
And did not go to work. By the time I wanted to get back into the field, or everything had changed. We went from card punch machines to, laptop computers, and I was way behind. So I thought, what do I really want to do? And I had wanted to be a nurse, and kind of like Sam, it was from examples of seeing other nurses work, but it was from the only time I'd ever been in the hospital was having 4 kids. So I thought I want to be an L&D nurse, but I quickly changed my mind when I got into that. But I came back here to Brazosport College, did all my prereqs, and then I did my first year of nursing school here because it was before Brazosport had a nursing program, and they had a agreement with another community college, and graduated from that. I knew because I was such a late bloomer nurse that I wanted to be an educator. So I continued my education right away because I knew I didn't have, a whole long career ahead of me to become an educator. And everything just fell into place. I did my bachelor's, then I did my master's, then I did the doctorate was after I came here. But there just happened to be a position when I
So there's a path
graduated.
for the students that are listening. It sounds like there's lots of different ways to get to this point. If somebody's interested in nursing, the nursing profession, you can get to it in different ways, starting at different points in your life. And
Yes.
yeah, you guys are good examples. Let me ask you this. So you've been teaching with our students. You've both been working with our students directly. I've seen you in action. I've seen your experiential learning environments, and you've got all the the cool toys in terms of, the simulation labs and all the things that come with it. But at the end of the day, it's our teachers that make the difference. So what do you enjoy the most about working with our students? And why do you think the program is so successful?
For me, the part that I enjoy the most, like nursing school is incredibly hard. That is no secret. That doesn't change regardless of what school you go to. The content is hard. There's a lot of it in order to be able to take care of another human being who have a lot of similarities but are also different in how we respond to situations and what we experience. And so the content is incredibly hard. And so what I love about being here at BC and being a nurse educator is helping make that really difficult content easier, helping them connect the dots, helping them go from, just not knowing any of that. And then at the end of the semester, they're functioning as a nurse that first semester. And so just helping them have that moments and build those confidences and just giving that option to them. Having a nursing degree is a life-changing opportunity for everyone. And so it's life-changing for them. It's life-changing for their family. It opens up a million pathways for them. And so I just really enjoy helping them get to that point, helping them make that transition.
The transition. For educators, I think one of the greatest joys that we get is when you see a student that you started working out, who knew nothing about the area, right? They could be taking an intro class or something where they just come to campus, wide-eyed, what am I going to do? How am I going to get past this? And then you run into them at the supermarket or somewhere in the community, and they've got these great jobs, and they're doing great. They've got families. Their lives have changed because of what we've taught them here. I think that's, to your point about we all have a common purpose, even though we get there differently, it's a great aspect of being a teacher. Dr. Quave, what do you enjoy about working with our students?
A couple of things. It's just so exhilarating, I guess, when you see the connections start. Their whole demeanor and personality changes, actually. You just see all the lights going on.
The light bulbs
and
are
then
switching.
you feel like a proud mother. And I still work in the field every once in a while just to stay abreast of everything. I work in perioperative services, which is what I kind of settled in. I went through a lot of different nursing, and then that's where I ended up. I actually work with several of our graduates, and I also work there with other nurses that I've worked with at other places.
So what's that like, Dr. Wave? You were their teacher, and now you're in the actual setting working side by side as colleagues.
It's so neat. Yeah. It's so, like, every time when they get a hard IV stick or something, I'm like, yes, I'm so proud of you. But these people have known me through various stages of my career. So I have some people, it's funny, I'll go to the floor, like, to take a patient up, and they'll be like, hi, Lea Anne. Hi, Mrs. Quave. Hi, Dr. Quave. And they're all like, no, she's Mrs. Quave. No, she's Dr. Quave. But it's just so nice because I've been in it for so long now, because I'm going on 8 years, that I see them in different stages and they're seeing me in different stages. And it's just, I just love knowing that I have changed someone's life.
I was going to add as far as like the community of nurses in this area. It's a small town, but it's an even smaller nursing world. And so when we take our students to our clinical industry partners, to these hospitals, to these clinics, it is incredibly common for the nurse that we're pairing them with for that learning experience to be a graduate of ours several years ago. And so it's our graduates teaching our new students, teaching them, and it's just, you can just see the cycle continue, and it's really neat to watch.
So Sam, let me ask about the program. Same for you, Dr. Quave. Okay, so there's a couple of things that I want to touch on. One, you mentioned something that's important, which are these clinical sites. And a big part of the nursing program is having this hands-on experience. So from the time that they get to the program, they're not just getting the book part of the program. They're actually doing a lot of hands-on in our labs, in our classrooms, but then they all go out into the community. Can you let the audience know what it's like to not just manage that whole clinical sim, but what is that exactly, and what does it do for the student?
Yeah, so our students do get a lot of hands-on, both simulated and kind of real patient care experiences. They get a lot of variety of that. So a clinical is the student going out into the community setting in a healthcare setting, whether that is a doctor's office, a hospital, different clinics like surgery and wound care centers, things like that.
But they're all supervised by our program.
They are supervised, yep. So we have either faculty that are in site or in the facility, monitoring them, asking questions, trying to help them dig out information and connect those dots, or they're with a staff member of that facility that has gone through training with us and signed an agreement with us. Serving as a preceptor is the language that's used in our environment. But basically, they're partnering with us to help train that individual if it's not our own faculty that are present.
So let me ask both of your faculty members, how much of that hands-on piece do you think translates to the success in the program, which we're going to talk about in a little bit, but how much of that actual hands-on do the students get to do? Like, how many hours a week are they doing?
Oh, it varies, throughout the program. As they progress through the program, they're doing more hands-on and less didactic, which is the book learning. Right. But there's a lot of hands-on, and I really think that is where the connections start really happening. They learn about all this stuff, and through lecture and through reading and through activities that we give them. But then when they're actually doing hands-on, they're like, "Oh, that's what you were talking about," or "Oh, now I see how that works." And especially with our diverse population of patients in this area, when they get into clinic, they're not as Mrs. Resecker said. Sorry. They're not just taking care of a patient with one disorder. That patient has several disorders, so they're really, with that hands-on, they're able to see that the things they do for the patient aren't just, don't just include what the patient's there for. It's everything that's going on with that patient.
Let me ask this. Okay, so you're preparing our students, and nursing is kind of interesting. It's one of these professions that none of us ever hope that we need the services of someone in the healthcare profession, right? But when we do, we want them to be the best trained, to be the most empathetic, to be the most sympathetic. We need really great healthcare workers. But we all hope that no one ever gets sick or ends up in the hospital. But how do you teach our students to deal with, because I've seen this in what you guys do in your classroom, you have scenarios where you actually make it stressful for the student so that they can experience in a supervised setting, in a clinical setting that is being proctored by trained professionals, in this case our faculty, to ensure that they understand that these scenarios have a wide range of outcomes and responses to them. Let's talk a little bit about that, because I think it's important for those that are interested in wanting to come into the nursing program, how you prepare students for something that can, it can be a pretty normal day, whatever that looks like in a healthcare setting, or it can be stressful where you're dealing with, life coming into the world, or, in some instances, life leaving the world. How do you teach students to, address these different levels of stress that they experience in the profession?
Well, we have an awesome sim lab, and our mannequins that we use can do a variety of things. They can talk.
And for the viewing audience, Doc, the simulation mannequins are high-end,
high fidelity,
high touch. These things they are very close to the real thing.
Yes, they have vital signs. They can talk, they can cough, they can simulate all sorts of bodily functions. And we introduce simulation at the very beginning, and we stage it. So they may have a very simple sim with a patient in clinical 1, and then clinical 2, it's a little bit more difficult. Same patient, starts as the same scenario, but we add to it. So that builds on what they've learned throughout the program and how to handle the different things that can happen in a scenario. And we partner them when they go in for the simulation, so they get to kind of build off of each other too, what each person does in the simulation. That's one way that we make sure that they're prepared for different scenarios with the same sort of patient.
So Sam, on your end, how do you, as a program director, how do you weave into the curriculum or into the instruction or the discussions that you have with students? Because dealing with a stressful situation as it is happening in the now is very different from dealing with stressful situations that they see every day over a long period of time. And we've talked a little bit about that in terms of how we interject, the need for empathy and how you work with individuals to develop these human skills beyond the technical skills that they need as nurses. Tell us a little bit about that. How do you work with students to prepare them for a life of service in nursing that can be stressful over a career. How do you deal with that?
And you're right. It is a stressful career. So it's funny that you left
know.
real estate to come into
Yeah, to be
nursing,
less
right?
stressful.
Yeah.
Those perceptions. But I think part of it, as far as preparing people for the realities of the job that they're wanting to pursue, is sharing it from the beginning, being
Letting
upfront,
them know.
and trying to teach good self-care habits.
So
Adding
what are
that
some
into that.
examples of that? How do nurses take care of themselves?
So one of the things is just making sure that that you're not working too much. The availability for extra hours, especially like during the COVID pandemic, was insane. I mean, working just to help cover the need that was there. But and that's an important piece to step up and help your community. But when we're not in a pandemic setting, making sure that you are leaving time to take care of yourself, exercise, sleeping well. Having a regular schedule, doing things that bring you joy and relaxation when you're not clocked in, when you're not working. But when you are working, I think one of the things that's so neat about nursing, and that's the world that I know, so maybe it's elsewhere too, but it's a family. And in a family, you love each other. You have moments where there's tension, right? And so you have all of it. You experience some really hard things together. You experience really fun, silly things together too. And so you lean on each other, and that's who understands what you're going through, what you've experienced when there has been a death, when there has been a really hard thing to be a part of, a situation, to watch someone hurting, to watch, some of the unfairness that
Someone
happens
who's in
life.
pain or,
Mhm.
Yeah.
Your team around you certainly understands what you're going through, and so you have that ability to debrief. But teaching our students that, our students are in the hospitals doing CPR on individuals that are experiencing, a cardiac arrest situation, and so they're experiencing it now as students, and they're delivering babies, helping deliver babies too, and so they're experiencing it. And then as faculty members, we're following up with them. We know you were a part of this. How are you feeling? What are you thinking? And that's what we call a debrief, is letting those emotions and thoughts come out and, talking through what they experienced. So all of that is to help build that stamina to get you through a nursing career in a healthy way.
And you all work with that in the program to prepare us, because some of our teachers, our students in the program are some of the best prepared. And I want to talk about the success that we've had in our program. So we've always had a really great nursing program, but recently, and here are the brags, in terms of what goes on with the program, we've got 100% pass rate on the NCLEX, and I'll let you guys explain the technical pieces to the exam. But now, I guess this was the first time that we also have 100% pass rates in our ADM program. So I know you guys are super proud of that.
Yes.
What has changed in the program that has when you got 100% of the students? I mean, we say that because we experience excellence at BC all the time, but what does it take to get an entire class of graduates to 100% success? I mean, that's pretty phenomenal. Congrats on that. But what goes into that?
Yeah, so it's a lot is the answer.
Yeah, a lot of work.
It's a lot, but for one, just for the listeners, the NCLEX is the standardized exam that all graduates from a nursing program take once they've completed the nursing program. And had I not been in the nursing education world, I would have just assumed that the expectation is that everyone would pass that test. If you've gone through the degree program, surely you would pass, and that's just not the case. And I think that just points to how hard the content is, how deep of
Rigorous.
level the questions are that we're answering. It can be the right answer for this question, and it can be the wrong answer given this tiny little added statement within the question that makes that now not the correct answer. And so that's one of the joys of being a nursing student and being a nurse, right? We don't come with a multiple choice options when I'm taking care of you. I need to be able to decipher all the other things it could be and come up with a plan.
It's a great point. You're not going to have a multiple choice. It's like I got to respond with the most appropriate, scenario for this patient. I mean, yeah, because we're dealing with people's, lives and their well-being and their health. So
there's hardly ever an always or never statement in nursing. It's this, except for if that, and if that, then this, and And so it's just a lot. But so as far as the NCLEX go, that exam, the Board of Nursing requires a nursing program to be over 80% or above. That's
Which
the
we're
standard.
at the max.
And we've been at that for a very long time. So to be at 100, right, a huge gap there, that's really exciting that every single student that graduated from our program took that NCLEX the first time and then passed it. So that's a big piece. I think the things that we're doing, there's a variety of things that are working. I think it starts from the prerequisite courses they're taking, all of the sciences and other preparatory classes they're taking before they even come into the program, how we're accepting them into the program. We're taking a standardized exam for the admission acceptance. And so for me, I really think that points to everyone gets a fresh start, regardless of what your GPA was when you were in your 20s and making decisions, or you took this class and that professor was really hard. Whatever those details are in the background, when you come to apply for our nursing program, everyone is on an even playing field. You show us what you know right now, and then we have incredible faculty. We have highly trained, highly experienced faculty that work incredibly hard to make sure all the pieces are there, that we give you that opportunity to learn and experience those things.
Sam, and for those of you that are viewing in the viewing audience, especially students that are at BC or thinking about coming to BC and being part of this nursing program, as you're hearing from our faculty members and our program director, it's at the highest levels of excellence. But that also means that we have the highest level of really great faculty members. So, Dr. Quave, for you, what do you think makes the magic happen amongst the faculty? We've got these really great outcomes. We're known for excellence. We've got these 100% success rates. What happens within the faculty body in the nursing program that you think brings all this excellence to bear with the students? And how do you get from what you know to what these students need to know?
Well, all of our faculty are they're wonderful nurses. They come with a diverse background of experience in nursing and in life. We work well together. We're all open to listening to each other's ideas, and we are encouraged to share our ideas and innovations and try something new. And nursing there's a thing called the nursing process. And it's a step-by-step way to get from our goal to our objectives to our goals.
Right.
And we kind of use that as we evaluate the students' progress. We assess what we're doing. We evaluate if it's working or not. We change it up if we need to, change our goals, and then reevaluate. It's just a circle that we keep doing. And we're all really good at sharing in the pieces of that and giving each other encouragement and ideas, so that if I came to the table with, I have this idea, I want to do this, instead of someone saying, no, I don't think that's going to work, we're like, okay, how can we make this work? Let's try this, let's see if we can make it work. And I think if you add this to it, it would be better. And we're just all good at helping each other do that, get to our goals, to help the students reach their goals.
Sure, you're right. Everybody's working towards the success of our students.
Yes.
So let me ask this. Okay, so speaking of students, because this is a very coveted program, not everybody that wants to be a nurse becomes a nurse. This is, like as you mentioned, Sam, it's a rigorous academic program. So, students obviously have to come with a good academic perspective in terms of their focus on studies and, the things that they need to do, like work hard and be diligent about the things that are important in what the faculty are expecting of them. But if you could give students advice, say, hey, future students, you want to be a nurse, here are the things that will help you prepare for the rigors of this program. If you want to be part of 100% success, this is what that looks like. What would you tell students? What would you let them know?
What you said as far as coming in prepared is absolutely true. The prerequisite courses is not just a checking of the box, and that's true for the prereqs courses, and that's true for the courses within the nursing program, meaning that you're not just getting through the course.
Right.
At some point, you'll be standing in somebody's mom's room, right? You'll be in their hospital room. That will be your patient for that day.
No pressure.
Right? No pressure. It's just their mom. It's just their most, important person of their life. And you will need to be able to recall the information from that prerequisite course and from the skills course and from the concept course that you were taking. And so it's not just getting through the process, it's understanding that we are going to be responsible for helping protect, advocate for someone's life. And so just coming to and through that information with that mindset, I think is important.
And like eyes wide open, knowing what they're getting into. What
We're
about
not-
their academic preparedness? What should they be studying?
So anatomy and physiology, the sciences,
Stigma.
human sciences are key. If you can have a really solid understanding with that information, a lot of the rest of it'll be easier to understand.
Right.
We do this, we elevate the head of the bed when someone is short of breath because of the anatomy and physiology that happens when we change someone's position. And so rather than just knowing that that's what you're supposed to do, and like you can understand the why behind it.
Gotcha.
So those anatomy and physiology courses are important. I think besides just, prepping knowledge-wise, I think I said the program is incredibly rigorous. It's incredibly difficult. So I think other realistic things to get yourself ready to coming into any nursing program is trying to have the rest of your life in as much order as you possibly can, and coming into that
So
prepared.
no distractions or limiting the distractions. Yeah.
Trying to get all the other pieces of life as organized and ready as possible, so that you can focus on school.
Because there's a tremendous time commitment.
It is.
What about you, Doc? So you took a different alternative path to getting to that. What would you tell a student? I think one of the messages that you and I have talked about before is that you set your mind to it, you can get to it. But what would you tell a student who says, I would like to be a Dr. Quave in the future? How do you get to that?
Basically, like you said, you have to want it. You have to be able to see that goal and just don't give up. And I just can't help but call you Sam. Just like Sam says, you have to get everything else in order. Sometimes that's hard. Sometimes we can't get our lives in order. I know myself, I had a hard time. I struggled getting through school because of things going on in my personal life. So sometimes you just have to put those things in a little box or something. Just when you walk into the door of the school, or when you go into your designated study time, you have to compartmentalize and just study what you need to do. Do what you need to do. And something I always like to tell my students, I share my story with them because I know there's students out there that are in the same situation that I was in. And I think that's one thing that really does help them. We do share real life situations with the students to try to, build that rapport. And when they look at us and see us as people too, not just these figures that are up there throwing things at them, they know we care about them, and that helps. And we encourage them to come talk to us if they need to.
And you mentioned something important, because, we talk about how rigorous the program is, and that, not everybody gets in, and, what you got to do to prepare. But once they're in the program, there's a lot of support on campus in the program. There's a lot of safeguards and rails to make sure that the students, if the student is doing their part, the college and our faculty and our support programs do their part. So it's a partnership. We want the students to be successful. And plus, if in the event that we need a nurse, we want them to be the best trained nurses ever. So let me shift gears a little bit to a lighter kind of subject, because we've talked about rigor, we've talked about the faculty, what got you to where you're at. But, being the college president, sometimes you get some pretty heavy emails about things that are going on the campus that you got to address. But sometimes you get these really cool emails. And a couple of days ago, Sam, I got one from you that said, hey, we're cooking burgers on the 6th of May. Can you join us and come out and celebrate the accomplishments of our faculty, of our students? Tell us a little bit about that camaraderie, and how did you guys get to the point where we're going to be cooking burgers for the faculty, which is, I think, is a great idea.
Yeah, we're always about food.
Food and ice cream.
The fuel that keeps it going.
Yeah. So, Nurses Week is a national celebration. But it is a family. And like I said, when you experience difficult, hard, stressful situations together, it just naturally forms a bond. And so that's true of our faculty and our students. That's true of those of us that work in the community
Right.
still in those areas. And so, and I think it's important to have those moments where it's not just talking about curriculum and not just talking about evaluations and those pieces, but to also have those moments where
Sometimes
we're fun and just people
burgers
and
and ice cream make
yeah,
things
so
make
burgers
the
with
world better.
bosses.
That's
Yeah.
good. That's awesome. Burger with bosses. Well, and I know that you all do a lot of things like that to build that camaraderie and keep that going, because that's the byproduct of this, 100% excellence with our students. Let me ask a question on a little bit more shifting into the program, what we teach our students. As I was preparing for this podcast, do a little bit of homework on nursing, and we talked a little bit about empathy and how we don't lose our humanity when you're dealing with some very serious day-to-day issues that happen in people's lives, like bringing someone into the world or sometimes being there at the last moments of someone's life. But really heavy subjects for the people in the nursing field. But let's talk a little bit about ethics. Ethics is a big piece to what we teach in this program. How do we instill these what I think are profound life skills that will carry them forever? Talk to us about what's in the curriculum to teach the students how to be ethical in their decision making.
Yeah, so I mean, just the content, just the different aspects of ethics, autonomy, being able to have the client decide their own decisions for their own person, right versus wrong and different perspectives and things so that the content itself is within the curriculum, and then the students are given opportunities to practice that, and it starts on a low level and build. So it may be what we call a case study, where they're taking care of a client on paper. There's not an actual person there for us to care of, but they're able to read through the scenario, and this is the setting, and and it could be a variety of situations where the patient has a not great diagnosis, but the family doesn't want the patient to know,
Right.
and they get to work through that on paper first and have their own internal battles of, well, what would I do and how should I handle that, and is there a legal answer to this? What is the process? So we start there on paper in conversations in the classroom, and then we can add to that in the simulation or the virtual reality world where they get to
These features are
experience that.
woven across the curriculum because it's that important to
It
make.
is.
Yeah.
And then, just within the curriculum, like holding that standard of ethics, right? We are not documenting things that we didn't actually do or find. We're not, not plagiarizing. We're not. So just having that standard of ethics within the program as they're learning how to be a nurse is important.
So, Dr. Quave, what's your take on that? I mean, you
Well-
teach the students every day. How do you convey in them this sense of we do the right thing all the time?
Well, nursing has a code of ethics that the State Board of Nursing publishes for us that we have to go by. And we do teach them things out of that code of ethics.
Right.
Most importantly, we teach them where to find all that information so that if they're not with us, then they have a question about what should I do? They know where to find the information to help them figure that out. And then also we have a lot of rules in our program, but they're there for a reason. They're there to uphold that standard of ethics and the high standard of trust that people have in nurses.
Dr. Quave, I've been to a lot of your graduation ceremonies that you have. Isn't there also an oath that nurses have to
Yes.
take before they actually enter the profession? Can you elaborate a little bit on that?
It's just a oath, not almost like the doctors have. We're not going to harm a patient. We're not going to do things that harm ourselves. That
Do the
would
right
put
thing.
us in a state of mind that we couldn't take care of a patient. It allows the students to actually become, part of that family in a way, but it also teaches them the importance of every decision they make. It's a life or death decision. Even the little bitty things, we always say, what's the worst thing that could happen to that patient? I mean, so they're there because they have a broken toe, but what's the worst thing that could happen?
Could be an
What's that scenario
infection
that
or-
could go downhill, and what are you going to do about it? And how are you going to follow the rules of medication administration, of documentation, of how are you going to stay within all of those guidelines and rules and be ethical about every one of your decisions?
So let me follow up. So you said something about state of mind and, kind of in line with what's happening with either the nurse's self-care or the patient's care. Nurses are also dealing, as we all are in a lot of spaces, with mental health issues, not necessarily the nurses, but what they treat, who they see. How do you prepare them to deal with all segments of society, all patients? How do you deal with those components and teaching them the aspects of mental health? Because that's also woven into our curriculum. How do you all deal with those?
Well, we do have a whole course on mental health. And you're right, every one of us has
Everyone.
mental
Everybody.
health issues,
Sure.
of some sort. And the one thing that I guess stands out to me is we teach our students not to judge anyone and not to put a stigma on mental health issues. If the provider has stigma against certain mental health issues, then you can't provide for the patient. So you have to just always remember they're a patient. They have problems just like you do. They have mental health issues just like you do, or I do. And we're trying to get the best outcome, and that's part of it.
Sam, how much of that happens in your classes in terms of, discussing the importance of mental health care for themselves, right? Because they're dealing with these, as we've talked about, these can be difficult, challenging, heavy subjects, as you're dealing with someone's, life or pain treatment or, just those levels of day-to-day kind of decisions. So there's that mental health piece for the nurse, but there's also dealing with a cross representation of people. How do you work with them in your classes specifically?
You're right. And so it is, right, the whole population. Certainly, different parts of the world have, maybe some differences, but for the most part, right, you're taking care of the whole world in essence, right? Everyone, different cultures, different religions, different experiences, different backgrounds. And so coming to it with, I'm here to care for you, regardless of where we line up on issues or perspectives or beliefs, anything like that. And then for training purposes, like there is, right, set curriculum. We want to make sure you're aware of these specific conditions, giving them practice. We're going to be using virtual reality to interact with some clients with specified mental health conditions so that all students get to experience that situation versus, maybe that type of client isn't there that day that they're at that clinic. And so kind of a standardized approach to make sure everyone has had the client that is non-cooperative. Everyone
Right.
has had the client that has anxiety. Everyone has taken care of someone that is dealing with depression. And so, again, just the ability to learn about that and to practice those skills in a safe, protected way, both for the student and for the client, so that we're
Right.
not bringing any increased stress or danger to them either. And so we just practice that in a controlled way, get that experience. The more times you experience something, typically the easier that interaction becomes because you feel more comfortable and more prepared, more confident.
So for the students that are listening or future students that are listening, it's all about having an environment that is positive in terms of our educational components. We give them an opportunity to make the mistakes that they need to make there so that they can learn so that when they actually when they're doing it for real, the mistakes aren't made. So that's an important piece. But you said something in your response, Sam, that I find interesting. You talked about virtual reality. There's so much changing in all of our educational fields with technology, computers, AI. I mean, the sky's the limit. I have a question for you. One, what's on the horizon for the nursing program? Because you guys are always looking at ways to improve. And two, how do you all keep up with all of this? I mean, how do you self-develop, not just as nurses, right? Because as faculty members, you have to keep up with your nursing credentials and all the things that are happening in that space, but you also have to be really great teachers. So how do you both keep up with what's happening in the space so that you can be at the peak performance of your own games in terms of teaching and working with our students? How do you do that?
I think as far as like personally keeping up, I don't know if it's just a trait that naturally happens for people that want to become nurses or if it's ingrained in the process of becoming a nurse. But I think we're all really just lifelong learners in that we want to know. So it's
Okay.
not someone pushing it on us to go learn the new thing. It's that we want to know about it. We're curious how it could help us as an individual, help our profession, help our students. And so I think that's part of it, just that we are intrigued by that. We are looking to implement virtual reality for the first time in our program in the fall. And I'm excited about it because we have an amazing simulation lab, but there are some scenarios that are hard to duplicate in a physical environment. And so virtual reality opens up a lot of doors for us to have scenarios. Again, it's all intentional, planned, strategic of we want you guys to all experience the same thing so that we can walk you through it and talk you through it and have have that debriefing session. So we're excited about having the virtual reality lab and getting our students in
Staying
there.
at the forefront. You mentioned some of the changes that are happening. In our next podcast, we're going to be talking to Isaiah Schauer and some faculty in our biology department, and we're going to be talking about these new AI technologies that are focused on editing genes and, preparing human beings for a healthier landscape and longer life. So that's going to be a super interesting podcast. That's the next one that's coming up. But Dr. Quave, how do you stay current, not just with what's happening in nursing, but to the same question, how do you continue to be, and I hear from students a lot, and I hear really great things about each of you, but all of our nursing faculty. How do you stay, latest and greatest on how to be a great nursing teacher?
Well, I get a lot of different newsletters and online magazines sent to my email. I signed up for a ton of them. And so I spend time every day going down rabbit holes with all of that. So, yeah, it just keeps me abreast of all the new things. And just like she said, we're always thinking, why is that happening? What's going on? What's in the background? So, always just trying to find out new things, and what's out there. Yeah, it was funny when I said going down the rabbit hole, because seriously, it's like I look at this website, then it sends me to another one, and I'll look up in my whole top line of the browser. It's just like all these, I'm like, wow, how did I get from there to here?
Pun intended for the nurses, but I feel your pain because I do the same thing. But, it goes to the students that are listening or potential students is our faculty are prepared. I am really proud of our faculty. I'm really proud of the work that they do in all of our programs. But the nursing program, as you all know, you guys get the brags in terms of you've got this 100% success rate, which if all of our programs had a 100% success rate, we would, be on the moon, right? But, I want to thank you for all that you do. And as we get to the tail end, pun intended, with Fred the Gator, but of our podcast, where do you see the future of healthcare and care for patients headed? What's happening? There's a lot of technology. There's a lot of things that are fundamentals, right? The foundations, the basics, but there are things that are changing. Where is healthcare and nursing headed?
Good question. I think obviously the pandemic required there to be a pretty big leap, not just in education, but also in the healthcare world. Telehealth is a very commonplace experience now for clients, whereas that may have been very limited in certain situations before. So I think that's one piece that's going to it. I think also you're going to see just creativity leaking out into the healthcare world as well. Like I see it in education already. How else can we train students? Do you have to physically be on campus to learn?
That's a big question that comes up.
Is there a way that we could do this in a different manner? And the answer is yes. And I think you'll see that in the hospital care world too, in doctors' offices, and just how else could we manage this? Do you have to do it the way we've always done it? Is there another option? So I think just a lot of changes are coming. Exactly what that'll look like, I don't know. One of the things I'm excited for is just the culture of nursing. I've seen it change throughout the day and that I've been a nurse, and then just looking back on the history of nursing, a lot more I want to say autonomous. We function underneath a doctor or a nurse practitioner, a physician's assistant, and I don't necessarily see that changing. But the culture of nursing in itself is a lot more independent in that we're advocating for, really strongly advocating for what our patient needs. We're not simply just following what the provider has indicated to be done, but really questioning, is that what's needed? We'll do that, but they also need this. And so I'm excited for nursing to just grow in its own profession and to be able to advocate for what our clients need.
You bring up a good point. Sometimes when I go to the doctor and, I know that you talk to folks, and if you can't get in to see a doctor, you're seeing a nurse practitioner, right? So that's changing. Doc, what do you think is going to change for nurses and healthcare in the future?
kind of along the same lines she was saying. I was sitting over here thinking about how people are, some people fear AI, that it's going to take over our jobs, take over the world. But I know, like, during the pandemic, there was a lot of, we can't go in that patient's room, but the nurses were still going in the room. The doctors weren't all going in the room, but the nurses were going in the room and then relaying to the physicians, to the primary healthcare provider, the condition of the patient. I've actually been in a room at a hospital where they had like a robot that had a little camera on it and a screen. The physician was at their office and they were seeing the patient, and the patient could see them on the screen, but the physician was asking the nurse to place the stethoscope, here. What do you see on their feet? What do you see? And the nurse was relaying the assessment findings to
the doctor.
To the doctor. And in a lot of cases, and we teach our students this, I keep interchanging patients and students. I'm caring for them.
Right.
But I tell them, anticipate what the physician is going to order, anticipate what you need. So nurses really,
so that goes back to that critical thinking piece,
yeah.
right?
We know a lot more sometimes than people think we know. But I would like to say something about the future of our program.
Yeah, let's do it. Where's it headed?
We're always looking for new ways, better ways to do things. And how can we make becoming a nurse or increasing your education in nursing easier for our community? We already have a transition program where licensed LVNs can become RNs, but we're looking at different ways to do that benefits and helps those nurses that are already working that can't necessarily take off a year to come to a program that's only offered in the daytime.
Right. So
we're looking at creative ways to do that, and other professions in the healthcare field, like the EMTs, or paramedics can transition into being a nurse too. So
it's a brave new world for sure, with not just technology, but also the demand and the need.
Yes.
How do we do that, and at the same time keep the highest levels of excellence in our programs? How do you meet the demand? So, ladies, I want to thank you so much, not just for being on the show today, but I want to thank you for all of the work that you do in preparing future nurses. Like I said, I hope that I never need a nurse, right? I think we all do. But when we do, we want the best trained, best prepared, best educated nurses. And I'm proud to say that I think that our program produces some of the best nurses in the state. So for the community members that are listening, for future students that are listening, this is an exceptional program at the college. Come out, find out about it. Come join us on May 6th for burgers. That's going to be one of the things that we're all going to be cooking up for our faculty. Those are the kinds of things that we do to support the success of our students, but the success of our colleagues as well at Brazosport College. So with that said, ladies and gentlemen, I am going to introduce one new item to our podcast, and it's called What's the President Reading or Has Read? I'm a big believer that readers are leaders, and this podcast, which will be available to the community in the near future, is housed in our library. And as part of that, we're going to create a new feature called What the President is Reading. And I'm going to recommend a book, and I'll be recommending books at every session that we have on our podcast. And this time I want to recommend a book that I would describe in one word as riveting. It is The Empire of the Summer Moon by Samuel Gwen. I highly recommend anybody who is interested in understanding the history of Texas, the history of the Comanche tribe. The book describes them as some of the greatest cavalrymen and women that the world has ever seen. The book is a fascinating tale into Texas history and how Texas came to be. I would recommend it for anybody. You will not be able to put this book down if you start reading it. So with that said, this book is available at our library. You can come in and spend some time reading and learning about some of the things that happened in Texas history. And each time that we have a podcast, I'll recommend a different book to our viewing audience. Ladies, thank you so much for being a part of Chomp Talk. We look forward to all the successes that you're going to have with our students, and keep up the great work, and no pressure on another 100%
Right.
For the next graduating classes. Thank you so much for being here.
Thank you, sir.
Thank you.
Thank you.